Okay, so in this tutorial I'm going to show you the alternative means by which you can conduct a test. So in the previous video we spoke about going to library. In this case we're going to go to our test patients. So we are currently in an agreement with the ITS and the security team not to put in any patient information within the application itself. I will show you a couple of examples. So one option would be to create a profile for you as the provider and store all your patients under this. Just orienting you to what you see here. So on the left-hand side of the screen is all the information on the individual. In this case, I did put in my specific metrics from the standpoint that I feel comfortable being able, and we're allowed to put in our own information such as age, gender, and so on. You can also see under the calendar view, you can see the little blue dots which indicate the assessments that were conducted and on which dates, and then the orange is the different trainings that have been conducted. And then if you look on total progress down in the right hand corner, for instance, the last one that I did was a squat analysis. If I click on that, these are now showing, I know it looks like a similar format to what we saw previously, but really what we're looking at is the tests that have been completed in the last 3 months. You can also toggle that so that it's more extensive than that time frame, and it will show you the progress over time there. Okay, you can also go to trainings. It has a similar filtering process, almost exactly the same as that of the assessments. And you can filter not only by the diagnosis that you put in. In this case, I gave myself a diagnosis of low back pain. And up in the upper right-hand corner, you can see that it would say low back pain protocol. And then these would be the series of activities that KINVENT has pre-automated for a flow of assessment for an individual with low back pain. They also offer the different training distribution of maybe what you would give to someone with low back pain. And again, you can see there's 20 seconds interleaving each of the different trainings there. But for the most part, the purpose here is to show you how to do an assessment on a given profile. So then you would hit assessment. You would go into the same workflow that was shown on the previous video. The other option that you could potentially do would be to create a surrogate patient. I would recommend maybe using your initials and then a numerical means, and then I usually just by convention use KV for the as in KINVENT for the last names, and then for date of birth I don't use their date of birth. You have the option to put in their year of birth, or you could plus or minus a year so that it really is completely arbitrary to the individual. But those are really the only 3 things that you need to input. And then once those are inputted, for instance, if I just did 91, okay. I guess you have to do gender, but you could do other if you wanted to. And then you could hit complete and you'd be off and ready to start your test. I'm going to exit that. But once you're into, it would give you a screen like this, for instance, a test patient, and then you would go into your assessment or trainings or what have you. All right, and that's how you would conduct a test. If you wanted to have subsequent means, if you wanted to have subsequent testings under a given profile rather than the fast track, which doesn't give you the historical data.